Palliative care is a relatively new program available to seriously ill patients and their family members. This video explains palliative care in the words of a palliative care patient and several care providers. They'll talk about the many different facets of palliative care, including pain and symptom control, the team approach, keeping your own doctor, and communication with patients and family members. Palliative care is different from hospice. It's not limited to end-of-life care. It focuses on maintaining the best possible quality of life for both patients and family members, no matter what the diagnosis.
Palliative care it's positive if you let it be. I mean, it doesn't have to be giving up. Now you're fighting for a different side. You're fighting for your health. You're fighting for the healthy part of you.
Palliative care is really about uncertainty, where the treatments and how effective they might be become significantly uncertain, but the burden of those treatments, physically, emotionally, psychologically, spiritually, become higher and higher. That's the point at which it's really time to say, how do I want to live my life? And how much burden do I want to take, and what do I really want to enjoy in my life?
I'd gone in for an ultrasound on what I thought was a gallbladder problem. And when they did my ultrasound, they realized that I had liver metastases, but did not know from where. So I immediately went to a CT scan and was diagnosed with colon cancer of stage 4 in my lungs, my liver, my lymph system, and obviously my colon.
The difference between hospice and palliative care are significant, but they also have a lot of overlap. In palliative care, you may well have treatments that can prolong your life, or you may even have a miraculous remission. The idea that I think both accept mortality as something important to consider, but in palliative care it's much earlier in the trajectory of illness and much more focused on using all medical treatments to help you live your life, and entertaining, along with the possibility you might die, the possibility you could live, and you could live a very long time.
Well, I think that at some point people are more concerned about their daily life and how they feel, and not the length of life. I mean, I think that for most of us, if we have a disease, we want to be able to cure it, we want to be able to live as long as we possibly can. But I think people sometimes get to a tipping point, and where the daily life and how they feel each day is more important than how long they live.
It's a balancing act. As long as you think something that is going to work, I'm willing to fight and put up with the side effects and be debilitated to whatever degree. But if it's not working, then you have to look at the balance of what's going on and make the decision that, you know, I can't get out of bed in the morning. I don't feel good. I'm not doing the things that give me pleasure, and I need time to heal.
The beauty of sort of taking a palliative care approach is to say to a particular individual, what makes your particular day a good day? What is quality of life for you? Help me understand what that is. And oh, you don't mind if you have a little bit of pain, but you just don't want to be sleepy. Oh, now I understand. Let's do this a little bit differently. Or, oh, you're embarrassed because you have urinary incontinence. That's the biggest problem. Well, let's tackle that sort of problem, as opposed to just assuming that everybody feels about their symptoms the same way.
I love the team approach to palliative care, and I think that that's one of the big strengths of palliative care.
It's rewarding and challenging working with people who are facing treatment decisions, spiritual issues, family issues, and that's why I love working on a team, because we're all supporting one another and communicating with one another. And it's like having a big extended family of care providers.
Most palliative care teams have a doctor, they have a nurse or a nurse practitioner, they have a social worker, some teams have a psychologist, many teams have a spiritual a clinician like a chaplain or somebody like that. And the idea of having this array of expertise is because quality of life has a lot of different dimensions.
You're not going to be the person you were physically before. And that was a big fear for me. That was a really hard thing for me. I've always been a very physical person. Climbing, biking, I work out constantly. And that, losing that is huge for me. And I told him, what if I don't have that, how is it worth, what kind of quality of life can you have? And Charlie was excellent. He said, you just reframe things. And there are other things out there that you can focus on. And you just look at something smaller, or you look at something different. And by reframing things, that's helped me immensely to go, okay, I'm not always going to be very physical. So what gives me pleasure if it's not that? What satisfies me if it's not that? And so you either learn new hobbies or books or movies or whatever small things you can do quietly and that still give you pleasure.
Another big issue is the perception that people have of being a burden. The burden is the illness, not the patient. And palliative care is a way of sharing the burden, getting other people to help you carry it so you're not in it alone.
And, in terms of the burden, that issue is so powerful because one of the other major things that I learn in the work I do every day is we have a myth in our culture that we're autonomous individuals and we should get what we want. In my experience is we are not autonomous individuals. We all live in relationship, in a web of relationships.
People often do use the word burden to describe, that's how they feel, that when they have needs that they can't take care of, if they lose their independence, they feel like they're a burden. But that's part of life, that often we do need to depend on other people. We certainly depend on other people at the beginning of our life, and we frequently need it at the end of life. And it seems to me with palliative care, we're kind of sharing that caring for the patient.
Doctors are trained to do things, and as long as they see something they can do that might modify an illness, they keep doing it unless you ask them to stop. If you ask them to stop, often they're relieved that they can stop doing, but for them to volitionally stop is very difficult.
It's not giving up. It's not giving in. It's just a different focus. And you still have all those wonderful people behind you, loving you and wanting to take care of you and make you feel good.
From a spiritual perspective, which is where I'm coming from, I see that people choose palliative care when they realize they're not giving up, but they're choosing a new direction that's all about finding joy in each day and discovering how they find that joy.
What I would like people to know is that there is a whole body of expertise about what happens when the treatments stop working, and that you as a physician or a patient or a family member should tap into it. And it's not out there on the internet. This is stuff that you will have to work out with somebody that you trust. And so you have to find somebody that you trust, and then you have to work on it. And then, you know what, you will be better off for it. There are big payoffs for it.
I know that the same people that cared for me during my treatment are still all there caring for me. And that doesn't change, just the focus changes. And so there's not any less love or concern or fight left. It's just a different focus. And they all want the patient to have the best quality of life as possible. They want them to find joy, and they want them to be satisfied with their day.
When you're faced with a serious illness, and the threat to your mortality, the place that is the easiest to go is a place of fear. And as you live your life in the fear of non-being, you aren't living. You contract and you are disconnected from yourself and the world around you. I think the greatest gift of palliative care is to have a group of professionals who are just really skilled at communication and relationship to create a safe place where you can just sit down and explore who you are, the community you live in, what's important to you, and begin to ground your life not in the fear of your illness, but in the power of who you are and how you want to live your life.